We have a world that's obsessed with symmetry and wanting us to look our faces to be symmetrical. And that's important because that actually can show you what health looks like. So whenever I see somebody who's very visibly asymmetrical on their external body, then I know that they're actually not mitigating what's going on internally.
Hi, I'm drjesscapeatross, and on my podcast, Dr. Jess Unfiltered, we uncover the real root cause of most misunderstood symptoms with help from top experts and real patients who've healed themselves.
Hello, welcome to the Dr. Jess Unfiltered podcast. Today, I'm really excited to dive right in and introduce one of my favorite people in the world. She is not only one of my best friends, but she is an excellent colleague of mine and does something pretty novel in the holistic health field. And this is really our first podcast diving into the physical body and the intelligence of that and how that can lead to overall better health if you're just looking at your physical health even. So one of my best friends, Alina Canner, here today. Thank you so much for being here.
Thank you for having me. I'm really excited to be here.
Yeah, so just to start out, because most people here are not really familiar with what you do. I know when I met you, I was not familiar with what you did. So how would you explain that to the general population?
Yeah, I do something very interesting. Most people don't know about it because most people, look at physical medicine and orthopedic medicine in just the way that they were taught in school. So with how we're taught in school, we're just taught in a one siloed healthcare system, and we're not looking at the body as a whole. So what my goal is to look at that physical medicine, look at that orthopedic medicine in a very holistic manner. And that encompasses looking at the nervous system and asymmetry and how that ties in together, as well as some other pieces, which I'm sure we're going to get into.
So you said asymmetry right there. I think I know what you mean, but just for everyone out there listening, why is asymmetry important? And we are built to be asymmetric. So I feel like in society, we're also always chasing asymmetry. So why are we made to be asymmetrical, and how can this lead to chronic pain for people sometimes?
Yeah, well, I hope you know because we've been friends for a while now, so Jess better know. But asymmetry is actually a fundamental part of us humans. We are meant to be asymmetrical. We are born asymmetrical. Our internal organs are asymmetrical. So what we see is that we have a world that's obsessed with symmetry and wanting us to look our faces to be symmetrical. And that's important because that actually can show you what health looks like. So whenever I see somebody who's very visibly asymmetrical on their external body, then I know that they're actually not mitigating what's going on internally. So we're meant to be asymmetrical. So I never want people to go home and be like, oh my gosh, I'm asymmetrical and that's a problem. It's not necessarily a problem. It's a problem when it's giving you problems. If you're having pain, if you're having dysfunction, if you're having nervous system dysregulation, and it's causing you issues, then sometimes we have to look deeper and see, well, maybe why do you have this asymmetry? Has it gone too far down a rabbit hole where one side feels extremely different than the other side in your body, and what really can we do about it?
Can you maybe give the example of maybe some just normal asymmetry in the body for people?
Yeah, a lot of people will see their right shoulder being slightly lower than the left shoulder. And we'll see that because, I can talk about first the actual asymmetries we see and then maybe why, but that's one. We'll see a left ear that kind of flares out more, maybe a pelvis on the left side that sticks out more, pops up more, maybe a pelvis on the right side that's lifted up higher, or a rib cage on either both sides or just one side that's flared out more. And all of these asymmetries are somewhat normal. I shouldn't really say normal. They're very common, but they're not necessarily normal to see externally. Internally, we have these asymmetrical features. When we see them externally, we know that there's a little bit of dysfunction going on.
Interesting. Okay, I know when we first met and you evaluated me, I definitely had that left rib flare. And you talked a lot about nervous system dysregulation actually for me then. I know in this podcast, even though we're new, we've talked a lot about nervous system dysregulation already. And so it is so important and central to health. I guess I would say, how does what you do relate to the nervous system? How does the physical body relate to the nervous system exactly?
Well, I think that everything I do is related back to that person's nervous system.
Really?
Yeah, because how we're looking at somebody and what they're experiencing has a lot to do with just their entire system and how it's communicating. So when I look at the nervous system from this perspective, I'm looking at a sensory component. And when I'm looking at that sensory component, I'm looking at how well does that person understand their body in space. And so if you have somebody who is a very stressed out person, they're in a fight or flight all the time, they probably don't understand their spatial relevance in the world. They don't have a solid experience of where their body is in space. That's something you're not going to know. If you lose, let's say, some peripheral vision on one side, you're not necessarily going to notice that. If you start to feel heavier in one side of your bite, which I know we're probably going to talk about, you're probably not necessarily going to notice that unless we bring attention to it. And all of these slight sensory changes, they actually can make somebody in a state of continuing that cycle of nervous system dysfunction. So everything I'm looking at when I'm assessing somebody, yes, I'm looking at asymmetry, but I'm always looking at how that nervous system is mitigating itself and managing in its external environment.
You mentioned bite and a few other things there. How in the world does, well, I'll just go there because I know what you do. How does, bite and the way the teeth touch and like even feet and other things you look at, you can encompass all of that here. Why does that matter for someone trained in how you're trained and for the nervous system as a whole?
Yeah, I even want to go to what you were talking about before with asymmetry, and then I'll touch on it with bite. But when we have these asymmetrical patterns, so we will typically see a body that is more dominant or kind of balancing itself. The center of mass is over more on the right side compared to the left side. And all those asymmetries I mentioned before are just due to where our body wants to go in space because of our natural asymmetry. Now, asymmetry happens usually because of the brain and because of the diaphragm. So the diaphragm on the right is bigger than the diaphragm on the left. It's bigger, it's stronger, it attaches lower into the lumbar spine compared to the left side. You also have a liver on your right side, which is on average 3 pounds. I'm small, so my liver is probably smaller, but like somebody who's 6 foot has a 3-pound liver, and that's very heavy to the system. Then you have a heart that sits slightly to the left, which kind of pulls that left chest wall open. So we have a body underneath everything that's asymmetrical. So then when we understand that there's this inherent asymmetry, now to go back to your question about the bite, we actually will see one side of the palate being more elevated compared to the other side. So we'll see these little components of asymmetry and patterns occur because of our anatomy. And when we have that asymmetry in a bite, and it's never addressed, or when we even have that asymmetry in a pelvis and it's never properly addressed, it's never able to orient over the right side and then come to the middle and orient over the left, that's when we see that nervous system dysfunction. So the biggest thing that I'm trying to give people is not to not be asymmetrical, because we're all asymmetrical. We're going to be asymmetrical. The biggest thing I'm looking for is how can I get that system to feel safe, to be able to oscillate and flow on both halves of the body. And that's how you can really help somebody's nervous system.
That makes so much sense, actually. So, with the bite, I guess there's a lot that goes on with the teeth, and I talk about the teeth a lot as well. We both think this is a very important part of the body that represents a lot. So, do you see when people have certain, I guess, physical variations that they may have other problems within the body, specifically speaking about the teeth and the mouth, that you see different genetic variations or anything there that matter?
Yeah, I mean, if you look at modern society, England, here in the US, you're going to see loads of, I should say, like dysfunction, variations that are dysfunctional. If you go to Africa, you're going to see things very differently. And there's this big pull in dentistry, whether it's genetic or whether it's lifestyle. There's a bit of both, but I do think lifestyle is a huge factor. And yeah, I assess all my patients in their mouth, and I'm looking at how their teeth are hitting. I'm not a dentist. Like, that's something I'm very clear about. I'm not a dentist because I study human movement. I cannot study human movement without looking at where they are sensing pressure in their bite. Because how you sense pressure in your bite is going to give your brain a feedback loop to how you're going to feel in space. So let's say we have somebody with a crossbite. That's like a good example. It's when we have teeth on the bottom coming forward and we're seeing a malocclusion, a misalignment in the mouth, and they're not going to be able to sense their teeth properly. we're typically going to see some different patterns in the pelvis also show up and in the rib cage also show up. It's never going to be, okay, this crossbite is here and nothing else shows up. That's why this medicine that I do, this physical medicine, is very holistic, because I'm never just looking at the bite solely on its own. I'm pairing it with all the other testing, and then we're treating it in conjunction with everything.
How the heck could the teeth or the palate change the pelvis?
Yeah, it's pretty wild. So it's like how I was explaining before, because of these patterns that we have due to our inherent asymmetry that we're born with, and then really lifestyle that kind of kicks the asymmetrical body to be problematic. Because of that, we're going to see that people will use maybe one side more than the other, and then maybe they're going to rely more on their right molars instead of their left, and they're not going to chew on both sides. They're going to start chewing more on their right side. And then, so now it's like chicken or egg. Did the bite create the problem? Maybe we're going to see, we will typically see somebody in this pattern has a pelvis forward on the left and back on the right, or maybe they're forward on both sides. There's a little bit of compensations and different things we'll see with patients, but it's definitely going to go back, and you're going to see some changes in the bite that may affect the whole body, and then vice versa. The pelvis could be affecting the bite. I mean, even right now, I have a patient who hurt her foot. She was great. She came, she saw me, we got her better. She was doing great. Broke her foot, and now since her foot has had a stress fracture, her mouth has been really giving her problems. Her jaw has been giving her problems. There's no way that her pelvis is feeling too great right now. Like, her pelvis is also in a state of a dysfunctional positioning. So it's never just one piece of the puzzle. So whenever I assess any patient, I'm always looking at everything. I do a bunch of different movement tests, and I'm looking at feet and how they interact with the ground, how the pelvis is moving, what we're seeing there, what kind of patterns we're seeing at the pelvis, because there are even some patterns at the pelvis that tell me how dysregulated a person is and what their nervous system really looks like. Or when I put my hands on their rib cage, I can really feel, a very rigid rib cage is going to tell me a lot about that person versus a very flexible rib cage. And then neck position is huge. I'm really big on that neck, because if you get the body to what we call like neutral, and finding that neutrality where they can go on both sides and be able to orient and rotate and move through all planes of motion that we need to be able to move to walk in space. Being able to do that comes with neck being able to move side to side, pelvis being able to move side to side, rib cage being able to pump. And all of it then goes back to breathing, which we haven't talked about yet, but I wanted to bring it up.
Oh, we'll go there in just a bit. Just out of curiosity, do you see certain personality types that go with, maybe a tilted pelvic floor, or, a certain high palate? Are there certain personality types that come with these genetic variations?
Yeah, it's really interesting. So you even asked me before, like, what are some of the asymmetries I typically see?
Yeah.
And I said lowered right shoulder. But if I actually see a shoulder on the right that's higher, then I know that person has more compensations, and it's going to be a little bit of a harder time for me to treat them. So when I see a variation from what the norm of the asymmetrical pattern is, and it's opposite of that, then I actually know that person's even in more stress. Their system is compensating over that first layer of sort of compensation. So, but what you said specifically about, like, kind of like the rigidity or flexibility, that, like, if I put my hands on somebody's rib cage and their ribs move really well, and I can say, hey, do a full exhale, I can get your ribs down, no problem, then I know, like, I know that person is going to be more of a flexible personality. And I'll typically ask my patient, like, do you care? Are you ever late? Or do you care if somebody cancels plans on you last minute? Like, what's your response to that? Because somebody who's more type A is going to be like, I'm never late, and I hate when people cancel plans on me. And their rib cage, somebody who's more rigid, their rib cage is going to be more rigid.
Interesting.
Versus somebody who's more flexible. I actually worked on one of our friends this weekend, and I was like, your rib cage is going to be so flexible because you're such a flexible personality. I didn't need to. I just know.
That was not me, just so you guys know.
Yours is not bad. Oh,
it's gotten better.
Yeah. Yeah, so we will see that. We'll also see, even going back to like ribcage flares, that's like a huge topic that people are very interested in, because I think many people have them. And when I see a really giant rib cage flare with both those ribs are what we call externally rotated and in this position where they're flared outwards, they're visible. If you're standing, you can see your ribs lifted up and out. Then I also kind of know that that patient or person is just in a state of go, like fight or flight a little bit.
Wow. Why would a flared rib cage equal flight or fight, like physiologically speaking?
Yeah. So if you think of like the gait cycle, so bipedalism, we stand up and we walk forward. And what we will typically see is in order to walk forward, we have to move over our right half, come to center, move over our left half. But what we'll see with people with a flared rib cage is that they've actually their center of mass has come so far forward in space that they've lifted their rib cage up just to manage their spatial awareness and to remain upright. Everything we do in life is for breathing and walking. Those are the most important things we have to do in life, breathing and walking. And our bodies will compensate in order to do that. So if we have somebody who is in a state where their center of mass has come forward and they're kind of falling forward, we're typically going to see those ribs elevate. And those are the people that constantly feel like they're being chased by a tiger. So if you imagine yourself, if there was a tiger by you, like your body would go into that fight or flight. That immediate position is flaring your ribs. Or ever think of like a time where you've had pain or any sort of like girls go through beauty and pains, anything with beauty, sometimes we go through pain. If you think of what your body does in that painful moment, it flares your ribs like immediately and you arch your back. That's just like what you'll
Bracing yourself.
Yeah.
Right? Yeah.
Yeah. So it's a very neurological response. And some people are walking around like that 24/7. And that's when it's problematic. It's not problematic to be in a sympathetic overdrive for when you need to be. When you need to go and do a lecture or do something that is going to get your heart racing, you might get into that position. That's okay. But can you get out of it? And the people that I'm seeing in my office, they are stuck in it 24/7. I also work in New York City, which doesn't help for many reasons. So,
Absolutely. Well, let me see. Let's go back to something because we are going to get into the breath, and you did bring up the breath. So it sounds like this very simple, practical thing that we all do. I mean, it's breathing. We don't even have to think about it. But if you're doing it improperly, or you've been tattooed in the body a certain way, as you like to say, you may be kind of headed towards nervous system dysregulation that we've talked about. So what do people need to understand about that and the breath in general, how important that is?
yeah. So I want to do like a little myth busting. Well, maybe I should explain my tattoo and skin reference and then I'll by myth busting. So Jess just mentioned like about the tattoo. So the way I like to describe these patterns is everybody has skin and that's the normal level of asymmetries we have. And typically we see a lowered right shoulder, pelvis forward on the left, head and neck staying over on the right side. But then anytime I see something opposite, that's when somebody gets a tattoo. So it's a bit of a compensation that has occurred. So we all are asymmetrical. Some people have a little more going on. Those are the people we're talking about here. And then I want to talk a little bit about myth busting. So, you go to a yoga class and they will teach you how to breathe. And they'll typically say, breathe into your belly. And when it comes to breathing, you actually don't really want to be breathing so much into your belly. Your belly is going to move. It's not wrong to have your belly move, but your lungs live all the way up into your chest. So you need to be able to breathe into your chest. Now take somebody with a flared rib cage. So their ribs are lifted up into that external rotation position. They are in a state of hyperinflation. What exactly does that mean? Is that they're kind of hyperventilating all day. They're never fully getting their air out. So when I teach breathing, I don't teach belly breathing, and I really focus on the exhale. The inhale is actually what changes the patterns and where we see these changes take place. But in order to get a good inhale, you have to have a really solid, strong exhale. And so the work that I'm doing with breathing techniques is very specific on the exhale and very specific on the position you're breathing in. Typically, if you lay down in meditation, yoga, anywhere where you're doing like breath work, you're not so focused on the position your body's in. You're more focused on how you're doing that breath. But breathing and the breath and the pressure of airflow will only go to the area of least resistance. So in order for you to actually make a change in your physical body, to notice a rib cage flare decrease, you have to teach your body how to get air into the places that it is very compressed there and doesn't typically get airflow there. So we will really focus on the exhale, like I mentioned, and we're really going to focus on the position somebody's breathing in. I put people into the craziest positions to breathe. I've been studying this stuff from an institute for a really long time. It's called Postural Restoration Institute. And the positions are very specific to direct pressure and airflow into regions that are compressed to make long-term neurological changes.
Yeah, I have to say, because I've experienced this personally, it's almost like an awareness that the body has to get that's missing, I would say. Wouldn't you agree?
Yeah.
It's almost like for me, I couldn't breathe into the left posterior part of my back, especially. And since I've learned to breathe out my ribs, I can actually exhale at my lower abdomen and at the very top of my sternum where I didn't have access to that. It's almost like I was neglecting that part of my body, almost like a mini stroke or something. You neglect like the part of your body. That's what I was doing. And so part of what you did was help me get into my ribs and into my exhale to figure out how to get a sympathetic overdrive a little bit. So I guess, would you tell people, besides the breath, you really work a lot with that, with the exercises with people, I think. You also do certain things with what they put on their feet, right? Explain that to people as well.
Yeah. So it's the same thing, like kind of what we talked about with the bite before. The way I look at it is you have really 2, maybe more, possibly 3 floors of your body. So your first floor is how your feet touch the ground. Second floor is your pelvic floor. Third is your diaphragm. And then fourth is really how your bottom jaw touches your roof of your mouth. And then you have your visual system. But back to the feet, how your feet touch the ground is going to immediately send a signal to your brain as to where you are in space. So shoes are very important to me. And I mean, we could do myth busting here too. But a lot of people will use barefoot shoes, but we walk on flat surfaces. So I don't have a problem with barefoot shoes if you're outside hiking on uneven surfaces, because that's going to give you the feedback loop of being on an uneven surface. But when you're walking in your house on wood tile floors in, barefoot, you're not getting any frequency exchange from the earth, from the negative ions from the earth, and you're also not getting the right proprioceptive input into your foot. So we actually use shoes that are a little bit bulkier, that most people are like, well, it's going to make your foot weak. But in reality, it doesn't make your foot weak, especially if you go outside in the sand and in nature and use your feet. What it does is it allows for your brain to have better sensory input because of the special qualities of the shoe. So we're always looking for a shoe with a heel counter and an arch support. And these qualities are really important to give the body a better signal through the whole system and into the brain. So that's why shoes are really important. And when I met Jess, she was already wearing a good shoe. But I actually put something in your shoes, which has been, you've liked those. And so I am a fan of orthotics sometimes, but they have to be made very specifically. Not every patient needs them. So there's always stipulations with it. But I do think shoes, feet, it all goes back to your sensory system and how well you breathe. Those are the 2 things that are really going to change how one feels in their body, in their nervous system, and how they feel on a day-to-day basis.
Have you seen people correct a lot of their anxiety through getting a corrective lens?
Yeah, I've seen, so when it comes to vision, whenever I have a patient that's very anxious, I mean, I work with a lot of providers, so I will send them out to somebody like a functional medicine doctor, a naturopath. I'm really big on that. I also do, I send them out to shamans or therapists or whatever I think they need. But when it comes to vision, people with true visual dysfunction, whether their eyes don't team together, convergence insufficiency, maybe they have a strabismus, one eye turns out, they're going to be the people that are a bit more anxious. And if I put it into a perspective like this, like if you were standing at the edge of the Grand Canyon and I was standing right behind you and you were kind of looking down, your body would like freeze up. That's because your visual system is giving you a signal of fear because you're at the edge of the Grand Canyon. Now, somebody with visual dysfunction, they're getting that signal all the time. So they can't differentiate like safety because their eyes are not able to do that for them. And when I say eyes, I really mean brain, because it's not really the eyes, are just the feedback loop that goes into the brain. So with specific optometrists, behavioral optometrists, I will typically go to the appointments with my patients, and we do a lot of things very differently. We don't sit them behind the phoroperator. We usually will have them stand up and do a gait analysis and do all these different tests, because we're not really meant to be using our eyes while sitting down and bringing our head forward. We're meant to be using our eyes while walking in space, walking, moving, breathing. So we do things quite differently, and I have seen incredible changes in anxiety, including myself with lenses, to be honest. So yeah, to answer your question, yes.
Absolutely. That's really cool. You have a personal story too. How often do you think attention deficit hyperactive disorder is a visual or breathing problem or a distractibility problem?
I really do think that there's more to the story.
Yeah.
Like always. And you can attack it from so many angles. ADHD and convergence insufficiency, there's a lot of research to show that they go hand in hand. And that just means the eyes have a hard time turning in and being able to team together as they turn in. And a lot of that happens from kids are really having it from being on computers. Right?
Really?
Yeah. Just being on computers, it's so close all the time. They're never turning their eyes out and diverging. They're never using their visual system like we're meant to use it. They're only using it with their eyes converging all the time. So that's a big one with ADHD. And also, if you're turning off one eye and using mainly one eye, you're going to see problems with that. It's just the brain is trying to process, and processing speed is really important. It's important for a child to get through school. It's important for us to be able to work as adults. And if you have a visual system that's not, the eyes are not teaming well together, there's so many reasons why that could be. Or even wearing the wrong pair of glasses, like wearing too much of a prescription, that in itself could give somebody ADHD, because it's just making that brain have to process the world in a way that's so much less effective. So then they have to work so hard, and it could easily give them some ADHD. I honestly feel like with myself, it's been a big game changer to change my lenses for my own ADHD.
I think that I've seen a lot with breathing patterns too, with ADHD in children, especially, and adults.
Definitely.
So,
Definitely.
how can you tell the size of a tattoo on someone when you see someone? How, the compensation you talk about in the body, how can you tell that someone's asymmetry is more pathologic, or if it's like normal? That how someone's out there listening, like, hey, I know I have, a heart on the left and a liver on the right, and that's normal, but like I feel asymmetrical in my body and it feels like pain. How would you know to recognize that?
It's interesting because I will see so much on the street, and I kind of, at this point in my career, I can zone it all out. And then there's some people, like, especially I live on the boardwalk, and on the boardwalk, you could watch people walk and you're like, whoa, that's really bad. And sometimes people that look so asymmetrical don't even have pain, and they're fine.
Yeah.
But people that typically come and see me, they're ones that are like, I feel like my right half is a completely different half than my left half. And my biggest thing is, it's not the end of the world if somebody's asymmetrical. What the problem really is when they have pain coupled with it, or dysfunction, or they just feel off. I mean, I think everybody can optimize. I really do. I think that everybody can go through this sort of assessment and really get lifelong tools from it. But I definitely feel like just because you have an asymmetry that's showing up externally doesn't necessarily mean it's a problem. I've seen some asymmetrical people that are fine. A lot of women will bring their husbands and they're like, we're good. And I'm like, how are you good? But some people are just totally fine. And I think that's a robust system, whether it's a mental system, like they're emotionally in a great place. Some people are more robust than others. So I think it just depends on the person. But if you are somebody out there that's kind of struggling and you just feel so different right versus left, that's typically what people will message me. They'll be like, I think I need to come see you. I don't know what you do, but I feel like you'd help me. I feel like my right half works so much harder than my left half. That's like a very typical thing I'll get. So if that sounds like you, then you probably need somebody that does what I do.
The way Alina and I met was that I was online talking about an asymmetry in my left and my right eye. And so I want to focus on facial asymmetry just for a minute, because she politely DM'd me and said, hey, I know you think this is, carbon monoxide poisoning only, which that can do it, but I think there's a little more to the story. And can you explain like why that would happen? Just what happens with that? Why was one eye higher and smaller than the other? Why are there facial asymmetries and why do they happen?
So we're going to see, like we talked about the skin tattoo pattern. We're going to see a typical patterning in the cranium. We'll see the cranial bone, the temporal bone on the left kind of flare outwards a little bit, and on the right flare inwards, which is actually the same pattern we see in the pelvis. So it's a complete mirror image when with the typical patterning. Sometimes we'll see a little more go on when there's more compensations, but due to that, and the sphenoid bone is a really important bone, sits like a butterfly looking bone right behind your eyes, and we'll see it kind of orient itself based off the rest of the position of the body. So if we're more on the right leg, we'll see that sphenoid bone come up on the right and down on the left. This little symbol is my sphenoid. And we will see that the eyes will follow that. And for you had something going on with the carbon monoxide, which I thought was fascinating, but I was like, I have to talk to her. But we will see that left eye in some people actually come up higher compared to the right. And that's more of a torsion case. That's more of that tattoo case. And we'll see that left eye become squinty. And that they need to kind of go through some craniosacral work can help, but they really need to do this sort of modality to make facial changes. We'll also see a lot of jaw deviation occur based off of the position of the head and neck. So if the head and neck come over to the right, if you have the sphenoid on the right a little bit more elevated, and then the sphenoid also has like triplanar movement. It's very complicated. It's a very complex system, and it takes really years to understand and grasp these tiny little movements. But all of it will then translate into even how you're using your eyes and also how your teeth are hitting. So we'll see a lot of people will have midline. I mean, I have one myself, a midline deviation of the jaw, because with the position of temporal bones, it kind of pushes the jaw to move slightly over to the left.
Yeah.
We see midline deviation in really high level athletes where the jaw moves to the left. Now, if I see the jaw moving to the right, I'm like, oh no, there's more going on. This person needs me so badly. So that's not necessarily that they have more pain when they have a higher level of pathology like that or compensations. It just means that they're in a pattern where they're going to have a really hard time getting out of it themselves. So I think that kind of got it. But yeah, there's a lot of cranial asymmetries and it's very complex.
Do you think stress and holding your breath could cause facial asymmetry?
When I see those torsional patterns, there's always trauma, like whether it's physical trauma for sure, head injuries for sure. Whenever I hear any sort of head injuries with loss of consciousness, concussions, that person is typically in a torsional stage, a right torsion. Any sort of emotional trauma, that's huge. People don't realize that. You've talked a lot about that.
Yes.
I've seen it in multiple cases since you've talked about it, where people go through horrific trauma and then their cranium is torqued. I've seen this sort of facial asymmetry in braces cases. I have I joke, but I have a grouping of patients that I call orthodontist children, because the children of orthodontists, they always want their teeth so perfectly straight that they actually torsion up their cranium so dramatically. And I've seen probably 5 or 6 children of orthodontists that have such severe torsion just from them having braces 2 to 3 to 4 times, because their parents just want the best for them. They just want perfectly straight teeth, but it actually creates so much compensation in the cranium. So, but those are really like the main things I'll see that torsion from. So stress that's all stress in reality. It's physical stress and emotional stress.
You said something about braces there and braces actually changing the facial structure. Can stress and breathing change our teeth pattern in a way, can they move our teeth?
I always start with breathing with my patients. That's go-to. We're going to start with the body. We want to change facial asymmetry and bite. Bite is a little bit more complicated because although teeth move very quickly, bite is just a little more complicated. If you've had people who've had braces multiple times, if they have permanent retainers in, there's complexities with it. But to answer the question, yes, we take a permanent retainer out of somebody, the teeth are going to shift very quickly. People know that. So when you give the body feedback, it's not just from breath, but breath is the main way we use the techniques to stimulate that feedback. But in those techniques, we're giving so much sensory input. You know, because I've cued it. Do you feel your left heel on the ground? Can you feel your left glute working? And I'm giving that brain that feedback of an entire hemisphere that it's neglected. And that's plus the breath work can really make the facial asymmetry change. and body asymmetry. It's all going to change at once because it's a holistic thought process.
Amazing. Okay. So let's get into something that will ruffle some feathers here. Let's talk about LASIK. Because I think people don't really think about it. They think, wow, this is an amazing way to get my eyesight back, to not have to wear glasses or contacts anymore. And you and I both are in the belief system that people don't get full informed consent.
LASIK is a big one. And for some people, it's great. Really high myopes, it's great. My best friend had a -9 in both eyes. She couldn't shower without her contacts in. She couldn't see the bottles and know what to put in her hair. So I think for some people, it's fine, and the majority of people will be okay. But there's a lot of people out there that are actually struggling with like post-LASIK syndrome. They have severe dry eyes, which are debilitating. They have like a corneal neuralgia where the cornea's nerves are just cut because that's exactly how LASIK works. They cut the nerves of the cornea. So the blood flow is limited. By the way, when I'm talking about LASIK, I'm also talking about PRK. Very similar surgery done slightly differently, but same effects. From an actual health medical standpoint, it can be detrimental. From a physical body standpoint, it can also be detrimental. So, and we were talking about it earlier today, there's a documentary called Broken Eyes. It's a great documentary if you're interested in this topic. But from a physical health perspective, when we are looking at how somebody is able to move right and left in their body and looking at their patterns of asymmetry, anytime you put a lens on their eyes that's correcting them for a long period of time, you're going to hold the body in either it's going to enjoy that prescription and it's going to be able to be malleable in that prescription and they're going to move really well in that prescription, or it's going to keep them completely patterned over one half of their body. And what I see with LASIK patients continuously after continuously is I cannot get them better on my own. I have to send them to a behavioral optometrist. We do about anywhere from 4 to 6 sessions together. It's usually closer to like 4 because by the first session, I already know they had LASIK and I already know that it's probably going to be a harder case. And the only way to really help these patients that have pain that they didn't even realize was due to their LASIK is to get them in, to get a better lens on their eyes and to actually just change how their brain understands space. Because LASIK, a lot of times they overcorrect just because your body's patterned. So if you're sitting down in that eye exam chair, bringing your chin forward, staring at a focal image where you have to look, you're looking very directly at that one image, the lights are off. That's just not how your eyes operate. Your brain doesn't operate like that in real life. We operate outside walking. So when we're being corrected like that year after year after year, it's very likely that the prescription is going to be much higher than what we actually need, which is my story. I was very overcorrected. For years, I had severe insomnia, which you would never think, oh, it has to do with your eyes. I mean, I had insomnia from a lot of things, but that's when it was really bad. And then as soon as I got out of those lenses, there was like a huge shift in my sleep. And I've heard other patients tell me about that, but I will see patients come in with hip pain, with shoulder pain, with neck pain. And it's not until we get them into a better prescription post LASIK that they feel better. So it's very interesting, but I am not for LASIK. I am not a fan at all.
Have you seen migraines, headaches, TMJ due to LASIK?
Yeah, because that cranial pattern is still stuck. So they're unable to move back and forth. We need that pelvis to move. We need the rib cage to move. We need those temporal bones to move so the jaw can move back and forth. And when you put a prescription, whether it's just glasses that's incorrect or LASIK, which is glued onto your eye forever, that's going to hold the bones kind of hostage, the nervous system hostage. I've seen headaches, migraines, sure, TMD, and also just severe stress and strain on a nervous system.
What do you think about people out there listening who are like, gosh, that sounds a lot like braces?
It's very similar. I think braces are a bit better because they're not so permanent.
Yeah.
Because LASIK is permanent. It is surgery to your eye. Whereas braces you can take off. A lot of times with treatment with like kids that have braces, I'll see like a 14-year-old and they'll come in and I can't get their neck to loosen up. It'll be a couple sessions in and they have braces on and I have to call the optometrist to cut the wire. They could leave the brackets on, but we cut the wire, we take it off, get their body to be able to oscillate side to side, move well, and we could put the wire right back on. I just did it with a patient over the summer.
You're kidding me.
Yeah, we do it. And it helps them. It takes off the cranial stress due to the inability for those teeth to move. Teeth have to have micro movements. They have to have flexibility and movement. When you have a permanent retainer or wired braces, even Invisalign, not as bad, but wired braces and retainer, you're stopping that entire cranium from moving. And this is like a very controversial thing in dentistry because dentistry is founded on the principles that cranial bones don't move. But they do move, or else craniosacral therapy wouldn't be a thing that works.
Yeah.
Or any osteopathic medicine that works on the cranium, or what I do. So cranial bones move. That's a myth busting. And braces and any sort of permanent wiring is going to stop that micro movement and really, really can cause issues. I mean, I've seen kids roll their ankles a lot due to it. It's the issue I necessarily think about to relate it back to the teeth. And so my whole purpose is to get that information out there to really like get people understanding, because growing up, I would have never thought rolling my ankle when I was 14 had to do with my braces.
Or your vision, I guess, either, right?
It's actually even more likely it was due to vision, because your eyes position your body in space. So do your teeth through the periodontal ligament, but the visual system and ankles have a lot to do with each other. But we'll see it with both.
How interesting. So I guess people out here listening they thought maybe nervous system was due to physical or emotional stress, but they've never thought about how their physical body could be playing into their anxiety too, by the way things are misaligned. So wild to me. Can you share with people out there, like, what is your maybe number one top worst shoe and then top best shoe to help regulate their nervous system?
I don't have a top shoe because I think every foot's slightly different. Some people have a higher arch or a lower arch or mid arch, or an arch that's high and collapses when it touches the ground. But I have a list. Every single 6 months, the institute I study from, they come together, they test a bunch of shoes. I've gone out and tested hiking shoes and summer shoes. And I have 3 lists that are free on my website.
Ooh.
They will always be free because I want people to be able to have access to the information. So I can send that link. But the lists are really important because it goes through in depth why, a high arch would be better with this shoe, why a low arch with this shoe. And typically, most shoes that are Brooks and Asics, some New Balance, and then sometimes Hoka, but Hoka is not for most people, even though it's a huge fad right now.
Yeah, it is.
They're way too cushy and they're a rocker shoe, so they have other issues. But sometimes we just need to try on a few shoes and get that person to sense their system differently, and then they'll choose. So I will typically tell my patients, go order 3 from Amazon, get them at your house, try them on, and you'll know what's best. But if you aren't sure, bring them in and I'll test your body with them. So, but shoes that's my lowest hanging fruit of getting people to feel better.
Amazing. Okay, so I'm going to do a little quick rapid fire with you. And can you say maybe 1 through 10, 10 being best, 1 being worst, what you'd rate it? What do you think? Are you up for it?
Yeah, I'm up for it.
Okay, what do you think about regular shoe inserts?
I'd say 6.
Okay. How about what are the glasses that get dark in the bright light?
Transition?
Yeah, transitional glasses.
Those are so bad. I don't know what the rest of them are. A 2.
Why?
Because your retina needs to get sunlight. You have to get sunlight to actually touch your retina. And when you have transitional lens, you are blocking all UV light. But honestly, even most glasses block all UV light. Sunglasses and regular glasses. So like my lenses that I wear, on outside on a walk, are CR39 lenses, which is a cheaper type of lens that actually lets the light to permeate through the lens so I can get it to the back of my eye. And the idea of that is that my brain needs a circadian rhythm. So I need to know what time it is in the morning and what time it is in the evening. And in order to do that, you need sunlight in your eyes. So I don't not a fan.
Perfect. Okay. High heels.
Probably 1.
Yeah.
They're so bad for you.
Nikes.
They're better than high heels. 4.
Curex inserts into shoes.
9.
Wow. Okay.
Great.
Amazing. All right. Mouth guards.
Okay, can be amazing, can be really bad. It really depends on how it's done, who you're doing it with, and the timing. I'll say 7.
Okay. Palate expanders.
Same thing. Also depends on how you're doing it, your age, timing. It's very dependent. 8, because for the most part, when it's done properly, it can be great, especially the ones that are like not so invasive.
Hot yoga.
Conflicting.
Controversial.
Yeah, because I don't love stretching so much, but I think if you use it from a meditative component like you do, I think it can be great. I don't know what numbers I have left. 6? I think I have 6 left. No, I don't have 6 left. 5.
So you can use them again. Don't worry.
I can.
You can use them multiple times. Yeah. On the scale. Don't worry. Yeah. You can say if you think it's less. Don't worry.
I was just trying to put them all in order.
No, you're being good. You're being, that's better. No, you can rate them however you can say -1 if you don't like them. So don't worry. How about people who play, what do you think about kazoos?
I think it's great. I mean, people don't usually do that, but I think a kid that is able to fully excel in a kazoo, 10.
You use this, don't you?
I do. I use them in techniques all the time.
Okay, interesting.
Or harmonica for a kid, 10 out of 10. Yeah, think about how much exhale you have to do.
So even singing.
Amazing.
Really? And
humming, whistling, 10 out of 10.
Why do you say that?
You're just using your vocal cords in many different ways, and it's just so good for you. Also, rhythm, music, anything like that is really beneficial.
Okay, amazing. What do you think about vagal nerve stimulators?
10 out of 10.
Really?
I think it depends on which ones, but yeah, 10 out of 10.
Okay, amazing. How about, what do you think about things like weight training and functional movement like that?
Also, depends on timing. If you're in a state where your body is really overburdened and stressed and you're not eating properly, not great. But if you feel good, 10 out of 10. I like lifting weights. I think you can do it in a way that makes sense for your body, but don't overdo it.
Root canals.
It's -7.
Very nice. I agree. Yeah, I agree. Have you seen those mess up people's nervous systems and their posture?
Yes, I have biological dentists that I send them to. And those are different than the dentists that I'll send people to for like braces and things like that.
Okay, amazing. You know, if someone has seen everyone and tried everything, they've seen a chiropractor, they've seen physical therapists, they've seen exercise specialists, they've done everything they can to fix their pain that they know within their realm of possibilities. And what would you tell them kind of the first thing they need to look at that's maybe been missed?
They've done truly everything and they come to me, I'm going to do my modality for sure. But I'm definitely going into emotions with somebody. I think that the people that really are struggling, there's always an emotional component. And even with what I do, I have seen people cry on a table just from a breathing technique. It's crazy when that happens and they have a huge emotional release or shaking, things like that. But most of the time, people that have done everything, they'll say they've done emotional work, but they haven't really done emotional work.
That's really interesting because in my field also, it's where I see a lot of roadblocks is that it's still stuck within the tissues, the issues in the tissues, right?
Yeah.
So I didn't really expect you to say that, actually. I thought you were going to say, I don't know, anything else, but that's really good. That aligns definitely with me. Can you give us an example of a really amazing transformation you've seen with the person who's done your modality and your techniques?
I actually have a few, but I'm going to give you one that is really interesting. So it's a patient, and she was a runner in college, and she was really struggling with issues with her hips for a really long time. And surgery, she did all conventional medicine, everything like that. And I did what I did on her to help her, but it kept coming back. And day one, I dove into her emotional history, and it all started after a tragedy in her family. And that tragedy brought on this severe pain. And until she really started to do the emotional work, that's when it changed. But that's more from that emotional perspective. In general, we'll see the craziest transformations with just asymmetry work and just that sort of the work I do. I think that there's always a component of emotions and emotional release. I've also have a professional saxophone player, and he had done everything, And with his height, sometimes people's height can really throw off their center of mass. With his height, plus any sort of professional musician where they focus on one thing for so long, their ear for music is actually really useful to the body, but it almost throws off their own internal rhythm. We all operate on our own rhythm, but then they're so zoned into that ear for music and what they need to operate on for being able to perform that he lost his own rhythm.
Interesting.
And I gave him a technique with a kazoo, and he was crying, and we did an appliance, and it changed his life. And so those are the kind of stories that I that makes me love what I do.
Absolutely. It's really cool because as a physician, I was never taught that the asymmetries in body, the way the teeth touch, the way the feet hit the ground, the way the visual system converges and diverges and perceives the world can really change how you feel and your moods and your pain and everything. So it's really cool to get your perspective. If I was gonna, well, I know people are going to eat up your information. So if people want to hear more about you and what you do, you see people in consults too, I believe, correct?
Yes.
So where can they get more of your information and see more of you?
Well, I primarily use Instagram as my source. It's at Alina Canner, just my name. And I work in New York City, Long Island, and I travel to work sometimes too. So you can book with me, and I have a bunch of free resources on my website.
Amazing. Ebooks as well too, I think, right?
Yeah.
So if you guys like information, you like learning, she gives a really different perspective and a fresh set of eyes to, I think, a system that has needed that for a long, long time. So Alina, you're also very active on social media. Can you give your handles there?
It's just my name, very simple. So everything is just Alina Canner. So
amazing.
Yeah.
We'll put it in the show notes for you. Thank you so very much for being here and spreading your love and joy and information to the whole crowd. So
thank you so much for having me.
Bye, everyone.
If this episode spoke to you, subscribe and share it with someone who can't find answers to what ails them. Please consider leaving a review. It helps others find our podcast. And download the Wellness Care Plan I've made for you for free on my site, wellnessplus.com.